Good evening, everyone. My name is Holly Williams. I am a 53 years old, and I'm a stage 2 high-grade serous ovarian cancer survivor and thriver. I was formally diagnosed in March 2023 after being told for many years that my symptoms were related to perimenopause and menopause and nothing to be concerned about. After having a radical hysterectomy and 6 rounds of chemo, I'm currently showing no evidence of disease. Initially, after surgery, I was off on medical EI for 6 months and then transitioned to private disability that I had through my employer. I'm currently on a back to work disability program as I'm unable to work at the same level I was at before my illness. Joining me today for this session is Maureen Parkinson, the co lead and content lead for www.cancerandwork.ca. Among her experiences, Maureen worked for 30 years at BC Cancer as the provincial vocational rehabilitation counselor, where she helped individuals with returning, remaining, and finding work after cancer. She created Cancer and Returning to Work, a practical guide for cancer patients, and developed and taught return to work and job search seminars for cancer survivors. She has completed the Certified Return to Work Coordinator program through the National Institute for Disability Management and Research. In this session, I'll be sharing my personal experience returning to work, the challenges I have faced, and what I've learned along the way. Maureen will give you more of a fact-based perspective, providing information specifically for cancer survivors, healthcare providers, and employers. When Maureen and I first connected in the planning of this session, I was surprised to learn this type of support program existed, as I had to figure it all out on my own. Our hope is that by the end of this session, all of you will know how to find support, what resources are available, and feel more confident about your path forward, whether that means returning to your job or exploring new opportunities. Maureen?
Thank you. Marion, can you bring up the slides? Great, and thank you so much for letting me come and talk about my favorite topic, cancer and work, both the topic and the website that I'm going to tell you about. So next slide. So the things to think about with return to work is be proactive and start earlier. So, the longer you're off, it can be harder to return to work. Sometimes there are time limitations on services and being able to return to your former job, like human rights, obviously economic loss, and it's never really good to have a lower income. It's not good for your health. Next slide. So I just wanted to mention, cancer and its impact. We've listed in the Cancer and Work website the number of common challenges. Certainly, the biggest ones I see that impact return to work is fatigue, nerve damage, and also a lack of energy, and cognitive symptoms and psychological challenges, such as mood and feeling stress and anxiety. Next slide. So one to think about, just sort of also what influences, certainly it's the impact of cancer and its treatment on you, including the prognosis, but it's also, and it was mentioned in the last session, like how do you feel about work anymore? Sometimes people have change in priorities. Sometimes people see work as bad or good. So also the support systems are available, again, discussed in the last seminar, what's available within the healthcare system in terms of rehab, or what's helping within your insurance that can help you rehab yourself to get back to work, and even the work conditions. So, what's the job demands of your job related to the challenges you have, as well as how willing is your employer willing to accommodate you? What is your relationship at work? What is your communication at work? They all influence. Thank you. Next slide. I think it's Holly next.
So the main residual symptoms that impacted me personally after chemo were mainly brain fog, extreme fatigue, and neuropathy in my feet and some in my fingers as well. Over time, the neuropathy in my fingers has more or less subsided, but I have residual issues with my hands, including osteoarthritis in some of my fingers and an unhealed fracture and torn ligaments in one finger, which locks with use. None of that was present pre-chemo. My brain fog has gotten better over time. However, I'm still often at a loss to find certain words when speaking, which is extremely frustrating, and which is why I have written down this presentation so I make sure I hit all the high points. On the advice of my care team, I get monthly B12 shots for the fatigue, which does help. My husband will usually notice I'm extra tired and remind me it's time for another shot. I still have significant neuropathy in my feet, which is mostly an issue at night before bed. as well as during the night. I get hot flashes, which contribute to not getting a good night's sleep. And I have found that magnesium spray applied to my feet at bedtime helps significantly with sleeping and also with staying asleep. The issues with my hands impact my current job in some ways that I now have to compensate for, particularly physically when lifting or moving things around, and even simple things that are usually taken for granted, such as stapling, hole punching, and writing, etc. In my previous job as a medical transcriptionist, I could type over 100 words per minute, but due to the effects of chemo, this has been reduced to just over 55. And my broken finger locks now, so it's very difficult for me to type for long periods of time. During the time that I was off, I worked extremely hard on my nutrition and started doing light exercise, as well as counseling to help with the impact on my mental health. My medical issues had also taken a toll on my marriage, so there was a lot of healing to be done on all fronts. I hired a cancer coach right out of the gate who had also had cancer herself. She offered a 12-week coaching program, which was extremely helpful in teaching about nutrition after cancer, and this has given me the courage to change my lifestyle. I no longer drink much alcohol as it gives me hot flashes, and I have to decide whether a drink or two is worth no sleep that night or even for the next few days. Things that may influence return to work can be financial, physical, or mental. However, it's extremely important to let your symptoms and the way that you feel from day to day lead your decision. Be open and honest with your employer about your limitations without oversharing so that they can be more understanding of your new reality. Maureen?
Thank you. Slides again. Thank you. Great. So the first thing is the next slide. So the first thing I wanted to talk to is about this website that's available called Cancer and Work, and its look is going to change in a few weeks' time. We're revamping it, but with my co-lead, Dr. Christy Mayo, and from McGill, we created this website with the help of those diagnosed with cancer and a number of healthcare providers and people from the industry. So it's designed, you see, for cancer survivors, healthcare providers, and employers. Next slide. So if you're going to go anywhere on this website, just go to the 10 steps to guide return to work because it's going to filter you to the areas. And essentially, the focus of this guide is first assess your challenges, then address your challenges, and then the last section is about transitioning to the workplace. Next slide. So I'm going to walk you through these steps a bit. So the first, we talked about when I gave you the vocational rehab, like talking about the four sort of factors that influence for return to work. So essentially you're doing an assessment yourself, but also you want to assess your function. So with that, physical, cognitive, emotional, using self-evaluation tools, and if you need professional assessments, asking for that from your healthcare provider team or your insurance. The reason why it's good to use tools is it adds to your credibility, using sort of tools that are out there gives you some teeth to what you're saying. And so we'll talk about some of those tools. Next slide. So within the cancer what we do have a list of tools that are available to you that can help you better articulate kind of the challenges that you're having, that can help you sort of put that on the agenda with your insurance provider or your doctor who's filling out those forms and determining readiness return to work. And the next slide tells you the next few slides. So next slide tells me one of my favorites is the cognitive activities checklist at work. Does a very good job of asking you questions like, are you having problems following a conversation in a group? So you can fill that, print it out, and show that to the people in order to sort of put your cards on the table. Another one, next slide, which is what we developed at Cancer and Work, is fatigue and energy tools. So an energizer drainer tool teaches you, what energizes you, what drains you, because these could be hints about how the pace of work looks like at work. So what brings you back and restores you. Similarly, the fatigue tracking tool just gives you an estimation of, how bad your fatigue is and gives some guidance there. So next slide. So the next is, after assessing sort of function, is comparing to the job that you're doing. So for example, assessing the functional challenges related to your perceived ability. In a perfect world, you'd get a job analysis or job description from your employer to present to your healthcare provider to sort of share what are the demands of the job. And I think about food server in a cafe where you're expected to load things from the back of truck might be different from a high-end restaurant when you have less people clearing the tables. But if all else fails, you can fill out a job analysis that we created at Cancer and Work. Next slide. So this where you basically allows you to assess your physical, psychological temperaments, physical strength, job, and compares to the job demands. And you can print it out or fill it out at the end where you show your doctor and say, this is, this is what I see, this is what's required of my job, and this is where I think I'm challenged. Again, it leads us into the next slide where we're going to talk about you're putting your cards on the table with the healthcare provider and also insurance providers because they're sources for rehab support as well, and saying, given these challenges, what are we going to do about it? So what are the medical and psychological and rehab options to help me overcome these challenges? And if it doesn't exist within the healthcare system, asking them to suggest refer on within the system to things like counseling services and online support or community agencies, or, in the case of your primary care provider, making recommendations to an LTD provider, if you're a lucky one to have it, to say, I think you need to be offering this. Like, and a particular one is occupational therapy, and especially in the case of brain fog. I commonly get my doctors to say, you need a neuro-focused occupational therapist, assess workability, and if indicated, to provide guidance on job accommodations and compensatory techniques. Next slide. So step 5 is take control. So again, besides asking your health care team, there's lots of resources that are out there to help you. And sadly, I think about Holly because Holly was in Vancouver. She never even knew that Voc Rehab, there's a Voc Rehab Voc Rehab, provincial Voc Rehab program that existed in Cancer Agency. And she didn't even know existed being in Kelowna. So again, going online, self-refer to your agencies, using resources like certainly Cancer and Work, educating yourself, again, using your time in terms of educating the parameters and long-term disability, just so you don't have any sort of pleasant surprises down the road. And, was mentioned in the previous session, advocate with yourself for these people, with your healthcare and insurance provider to get the services that you need. Next slide. So related to that, these are my sort of fan favorite, list of services. Within that is within the website, say you're looking for work. There's a number of provincial funded programs that are out there that are available. Certainly Wellspring. I don't think Holly initially knew about the Wellspring Brain program. It's excellent. And also soon to come at Wellspring, and this is available online, so virtually, is a fear of reoccurrence group that my colleague from the website, Christine Mayu, was involved. And then also the Cancer Society has a community locator. So their role is actually to help you direct you to the services. So you're thinking you want an exercise group, you email them or call them and say, I need a cancer fitness group, and they'll try and find you one in your community or at least online. Next slide. So again, resources within the website is we have a session on cancer, its impact on work. We list thinking about your insurance company. And also there's a whole section on workplace well-being because we certainly hear that a source of concern for people is anxiety at work. And so here's some ideas about what you can do to help yourself improve your resiliency. So next slide. So again, identify foster work support. So now we're moving towards the workplace. So it's good to stay in touch with managers and sort of be friendly with your colleagues because that's giving you a soft landing when you return to work. We find it makes a difference if you have support in the workplace. So staying in touch is important. And it's also at the time, find out kind of what their willingness is in terms of supporting you with return to work. And this is the time to think about disclosure if that's a concern for you. And I'm actually not seeing the bottom of my slide here. And also, if you can, give the healthcare providers, like your primary care doctor, as much notice in order to help you give them as much notice so they can make sure you have a job that's available for you. So you can walk in when you're ready. Next slide. So again, as I mentioned, it's good to look at your insurance plan just to see how it works. Often many plans are disabled from your own occupation. And then it turns after 2 years to any occupation. So that may mean for some that they may not continue benefits. Also, insurance companies even looking at provisions for partial disability. It's not that geared up for it, but it's to look like. So for a lot of you, maybe you can only go back a bit, a few hours or, say 20% of the time. You want to be exploring that in order to prepare for that. Next slide. So, and then again, so part of this is working with your doctor to provide the input to your employer to come up with a graduated return to work plan. And I say graduated because that's the tried and true way. So asking them to start and end dates, reassessment dates, definitely talking about medical restrictions and limitations and accommodation suggestions. And as mentioned, having your doctor call it a graduated return to work trial. So it's managing expectations. So if you have to change it, you're not having buddy saying, oh, you said this. It gives you some room to kind of adjust if you need. Next slide. So 8 is prepare for an imminent return to work. So a lot of people lose their conditionings. Like, your sleep might be out of whack because you're not getting up at 6 o'clock for work anymore. You want to eke yourself up back to that. And that's where doing a graduated work simulation can be very helpful. In terms of easing you and sort of slowly eking yourself back to the bedtime that you had to get you up in the morning and consult. So the biggie is sleep. So it's amazing how people don't address sleep until it comes on you. And that can be a big barrier. So you want to talk about that. And as I mentioned, simulate your work routines if it's safe. So you don't want to do physical demanding things if your healthcare provider hasn't cleared you. And also even thinking about commuting. And, a accommodation idea is maybe if you have a big commute in rush hour, can you come in earlier or later in order to avoid that rush hour commute? And, to explore accommodations to see, as part of your graduated work simulation, what helps you work smarter and helps you restore yourself. And then if you're worried about talking to people at work, setting your boundaries because you're trying to look after yourself, now's the time to be pursuing counseling, looking at boundary setting and assertiveness and cognitive behavioral therapy and conflict resolution, all these things in order to help you come back feeling stronger in yourself to speak up for yourself. Next slide. And then managing work expectations. So again, discussing long-term recovery with your healthcare provider, having it in writing, specifically restrictions and accommodation. So when you go back to work, you can say, this is what my doctor said. So you don't have to get in a fight. It's there in the return to work plan. And that also is considering, asking now sort of with your family and say, I'm not going to be around as much. In fact, I'm going to be back to work initially. I'm going to be tired. I need to help you step up and to discuss that. We might be needing to shuffle some duties for a while. Next slide. And so the last is really monitoring the work situation. I encourage you, if you start a graduated return to work, maybe schedule an appointment in there with your doctor for a follow-up, should that plan have to be tweaked. And then in order to discuss new sort of ways of managing your symptoms, that gives you a try, maybe something bubbles up as a challenge. You didn't think the cognitive stuff was an issue. So asking for more rehab support. So you're updating the medical note for your insurance or your employer. If you can arrange medical appointments outside work, I'm saying that just because sometimes supervisors, that they're unpredictable, can get cranky with that. But if you have a lot of medical appointments, that should be part of the graduated return to it. That needs to be written on the table. So we're managing their expectation. And thank you. And that's sort of that. And I think we're back to Holly to sort of fill us in more.
That was great. Thanks, Maureen. In early 2024, I was asked to join a community baking venture because I told some friends I'd been finding baking very therapeutic as a pastime and got to the point where I didn't know what to do with all the extra baked goods. This helped significantly with getting my brain back into a more functional and focused state, as it meant I had to retrain my brain with different measurements of ingredients, etc. It seemed to also help my hands for a short time getting the movement going again. I had to take a food safe course in order to do the baking, which worked my brain as well. I worked as a volunteer in the local market, doing cashiering, which helped with the social aspect of meeting people in the community where I live and also helped with counting money, making change, etc. The combination of all these factors helped me realize my brain was starting to heal, giving me confidence in returning to work. As far as my decision to return to work, approximately a year and a half after my diagnosis, I was still on disability, but being strongly encouraged to go back to work by my disability manager. I didn't feel ready, and my job of over 17 years had been eliminated while I was off, leaving me in the position of finding a new job and having to let a prospective employer know my recent health history. I struggled with what to put on my cover letter, how much information to share, and explain why I had been off for so long. This again took a significant toll on my mental health. I asked myself questions like, who's going to hire me now that I've had cancer? particularly with the fact ovarian cancer is considered a chronic disease as it is prolific for recurrence. Other questions going through my head were, could I relearn a new job? Could I keep up at the same pace as everyone else? I didn't want others to think differently or less of me because I had gone through cancer. After applying on multiple jobs and a couple of interviews with no success, a friend who worked at the local hospital encouraged me to apply on a couple of opportunities there, and I was subsequently hired on as a casual in the health records department for a clerical position. After all my worry about telling them about my illness, when I explained to my new team lead that I had had cancer recently, she sort of had a so what attitude and didn't really seem too bothered about it, which alleviated a lot of anxiety because that was not the reaction I had expected. Being back to work, I now had a commute, and whereas I had previously worked from home, and there was a whole new group of people to get familiar with. Initially, I was hired to box old expired charts to be sent off site. Sounds really easy, right? However, within a 6-month period, I ended up training for 4 different complex positions within the department for relief purposes, which let me tell you, after the brain fog I experienced and not being able to train more than a few days per week, each one of the desks was a feat in itself, never mind 4. But I didn't want to forego the opportunity, so I embraced it. Luckily for me, the office staff have been extremely patient and understanding, helping when I don't remember things and never getting frustrated when they have to re explain things many times over. My supervisor is extremely understanding as well, for which I am very grateful. When I first started back, I initially started working 2 days a week, increasing to 3. However, I found that to be too much, and I'm now back to working 1 to 2 days per week. As I find on the days I work, I am overexhausted and unable to perform duties at a comfortable level as the day goes on. Those days when I come home, I struggle hard to get off the couch after dinner and go to bed, so this seems to be working for me currently. I'm hopeful I will be able to work back up to more days per week as time goes on. I still wrestle with accepting that casual work is the best fit for me due to my physical limitations and my high level of exhaustion on work days. I am able to apply on other positions within the health authority. However, I likely will not return to full time work in the near future, which, having always had great work ethic, makes me feel somewhat stunted in my work future and definitely takes a mental toll as well. I've realized that work isn't as important to me anymore. I've been a self proclaimed workaholic my entire life, but after prioritizing my health over the last 2.5 years, for the first time ever, I'm continuing on that trajectory going forward. When I was trying to figure out returning to work, I felt like I was doing it all on my own. There just wasn't a clear path or anyone who could point me toward this kind of support. From what I can tell, the staff I've encountered at my local cancer center, specialists, and even my own amazing family doctor did not know about this program either. So now I make a point of telling them about it so nobody else has to go through that same uncertainty. Everyone deserves to know support like this exists and that they don't have to navigate their return to work alone. That's really what Maureen and I hope you take away from this session is that there are resources out there. And with the right information and support, there is a clear path forward. Whether that means returning to your current job or exploring something new, you don't have to do it all on your own. Maureen?
Okay, next slide. So yes, as Holly mentioned, the Voc Rehab program at BC Cancer Agency, which is unlike I'm seeing Wellspring Return to Work programs up there, but also BC Cancer Agency does a job search seminar and a return to work program as well. So again, Holly also mentioned she had to shift gears and look into finding new work. So we do have a section on that, including there is a career exploration section that was done by the head of the Voc Rehab program at GS Strong to help you sort of walk through that and gives you links to look at that. So within that, they might give you a lot of answers to, how do you handle disclosure questions. So next slide. So within that, one of the things I think is most powerful for career exploration and also for job search is actually to do networking and to ask questions like I'm following here, 80% of the jobs are found through networking, but also asking, tell me about a typical day. So, or what do you like, dislike? So that helps you if you're networking to find is without even disclosing about yourself, is that a fit for you? Next slide. So in terms of interview preparation, you certainly want to honor your strengths as well, because I think you might feel self-conscious and you need to remind yourself that you have some skills. and prepare for explanations and gaps in your work history. But be mindful that when it comes to disclosing, you actually only need to disclose your disability if you need an accommodation. And your disability isn't necessarily cancer, it might be the effects of cancer, like brain fog or fatigue and things like that. So being truthful and focusing on the positive and spinning it. So if you're saying, my organization isn't that great, but I find that if you send people emails or I do a to-do list, I never miss anything. So that's how you spin it. And again, keeping in perspective, remembering your work history, one question in the interview is one part of the interview. We used to do videotaping of people when I used to teach job search, and they thought they blew the question, but when they watched themselves on the video, they looked fabulous. Next question. Next slide. And that's it for me. Yeah, questions, I guess.
Thank you both for sharing. I know that was a lot of information. So thank you for going through it. We will be sending out the slides that Maureen shared today as well in an email tonight. So you will get those. Some great information, some great advice. I'm sure everybody wished they would have had access to those resources when they needed it. So thank you for sharing. I have a couple of questions. Holly, I've got one for you, and Maureen, I've got one for you. Holly, do you have any recommendations as to how a caregiver can best support a loved one in their decision to go back to work?
Yes, definitely. I think open communication with the person and saying like, how can I help? It might include things like making meals, stepping up a little bit that way around the house, doing house cleaning, understanding when somebody's a little bit more tired than they normally would be, letting them, when there's time off and stuff, letting them like have the rest that they need and things like that. That's been a big thing in our house. Just having
And
somebody
I
kind of just really have other people step up, maybe have friends make meals or stuff like that if that's what is needed.
And we also heard that from Melissa in the first session as well, is take the help when people ask, let them know what they can do for you. So thank you for that. Maureen, a question for you, and I'm not sure, I don't want to put you on the spot. So if you have any experience with this, you can answer. If not, we'll do some digging. Do you know if most private long-term disability plans supplement income if they return to work part-time after being full-time pre-diagnosis?
It's a great question, and it's something you want to research in. Sometimes what they do is they'll do a wage top up for a period of time, but then at some point, say when you're getting close to 67, they might stop, and it might even still be time limited. So that's why, it's particularly around the thing about partial disability, because that's what I'm talking about. Like if you can only work a certain amount of time, that you really want to look and negotiate that. The two times that I've worked with people that have been diagnosed with cancer, I've actually encouraged them to get a lawyer involved in order to safeguard them. Because especially when you're getting to like 50, 60, definitely 63%, because that's going to be when they see in their eyes that you're full time, they might cut you off. So again, really doing your research or getting good guidance around that to navigate is really important.
Great. So thank you both for sharing. And Holly, as we wrap up tonight's session, as someone who's gone through this process yourself, you've worked through it, you've had some hiccups, you've had some challenges that you've overcome. Do you have any final thoughts or one piece of advice that you would give others who are in the position of either returning back to work to the same job, maybe a different job, or maybe deciding not to return back to work?
I would just say be honest with yourself regarding your physical and mental limitations that you may have not had prior to the illness or treatment, and give yourself grace for the things that you may not be able to do anymore the way you did. It's really important to keep a positive mindset and accept that this might be your new normal and it's kind of a new version of yourself, and you're here.
Awesome. Awesome. Thanks for sharing, Holly.